Hey y'all, take a walk with me on my lunch break and let's clear up some misconceptions about HSV or herpes simplex virus because oh my gosh, we need to talk about this. So the first thing that I want you to know is that you can think about HSV1 and HSV2 basically the exact same way. So in your mind, there's really no need to differentiate between type 1 and type 2. Now, classically, people think about herpes type 1 being around the mouth and herpes type 2 being around the genitals, but that's not always the case. You can have type 1 around the genitals, you can have type 2 around the mouth, and why is that? Well, because people engage in oral sex. And I frequently have patients who feel or express to me that, oh my gosh, well, HSV1 is so much better, it's not as bad as type 2, when in reality, it's essentially the exact same thing. The symptoms are the same, the treatment is the same, the presentation is largely the same. Another thing that I want you to know is that there is reasonably no real way to tell when you may have contracted HSV or who gave it to you. And the reason is because after you're exposed to the herpes simplex virus, it sort of just lives in your body and can cause an outbreak or those visible symptoms that you see and feel at any given time. You know, maybe if you're stressed or sick or exposed to the cold. Many people are exposed to HSV even as little kids, you know, after your parents or family member give you a kiss and they don't know that they may be shedding the virus, or little kids in daycare kind of putting their hands in each other's mouths, that kind of thing. Another thing to know is that it's basically impossible to know for sure whether or not a person is shedding the virus. And by shedding, I mean contagious. So even if there are no visible symptoms, no cold sores, blisters, tingling, or outward symptoms, it's possible that someone is still shedding the virus and they're still contagious. Now, if it's been a long time since the last outbreak, the likelihood of shed or contagiousness is less likely, but definitely not impossible. So yes, you can potentially spread HSV even if there are no symptoms at that moment. The reality is that more people in the population have HSV, either type 1, type 2, or both, than don't. And not everyone who has the virus is going to show symptoms. And that's why routine screening for HSV antibodies in the blood in an asymptomatic patient is not really recommended or done routinely. It's true that HSV is with you for life. So once you are exposed to HSV, like I said, that virus will live in your body for life and may or may not ever cause symptoms. If you are someone who does experience symptoms from HSV, it is very, very easily treatable with well-tolerated antiviral medication. So if you are ever diagnosed with HSV, or if someone discloses to you that they have HSV, that is not a testament to the person's cleanliness or their safe sex practices or really anything about that person. HSV is just a very common part of many people's lives. It's manageable and it's nothing to feel ashamed of or embarrassed of.